Hi, everybody. Welcome to Be Time. I'm Beth Bierbauer, your host of Be Time, as well as a healthcare executive and author. Be Time is a podcast for those individuals that want to invest in themselves and their careers through continuous learning. Each week, I have the opportunity to interview a seasoned executive or other industry expert. We talk about important business matters, their personal as well as professional journeys, and their triumphs and their failures. So whether you're with a large corporation, a small business, or a startup, whether you're inside the healthcare industry or outside the industry, Be Time has something for you to help you stay on top of your game. So let's get started. Everybody has a healthcare story, and these stories can be powerful motivators to drive change. Our guest today has his own personal healthcare story, which drove him to create a company that would provide help, the type of help that he received when he had a healthcare crisis, the type of help that really made a difference in his life. And with us today is David Weingart. When David was 36 years old, he was diagnosed with type 1 diabetes. He was an athlete. He was in top shape. He had no history of family diabetes. This was a turning point in David's life. David was fortunate enough to meet a diabetes educator by the name of Cecelia. Cecelia helped David understand that diabetes did not have to be a death sentence. With education and the proper support, David could in fact live a full life. Cecelia was a nurse whose mother happened to have diabetes, so Cecelia took the additional training needed to become a diabetes educator. David was successful at getting his diabetes under control and resuming his athletic activities, but he wanted to do more to help people that were in the same position he was when he was 36 and diagnosed. So he founded a company called Fit4D. Last year, he decided to track down Cecilia, the woman who really turned his life around because she had such a major impact on him. And what he discovered was that Cecilia had passed away. So to honor Cecilia, he renamed the company from Fit4D to Cecelia Health. What a marvelous gesture on behalf of David to honor Cecilia in that way. Cecelia Health's mission is to transform the lives of those with diabetes and their related chronic conditions. To date, they have touched over 1 million lives. With David's tech background, he was able to leverage that technology to really help people at scale. And he does help individuals whether they have type 1 or type 2 diabetes, and of course with other related conditions. I met David several years ago, and when I first spoke with him, I was absolutely blown away, not only by his personal story, but how he was so passionate about ensuring that others weren't overwhelmed and lost like he was at the time he received his diagnosis. When I heard about him renaming his company from Fit4D to Cecelia, I just had to get in touch with him and let you hear about his story. So today, please join me in welcoming David Weingard, founder and CEO of Cecelia Health. David, welcome to Be Time.
It's a pleasure to be here.
Great. We are glad to have you. So, David, a lot of people deal with healthcare issues over their lifetime, but for you, this issue around diabetes seemed to come out of the blue. Would you share your experience and what happened with our audience?
Yeah, absolutely. I walked into a doctor's office one day, absolutely no energy, stepped on the scale. I was 30 pounds lighter than I expected. The shorts that I bought at the beginning of the summer were huge. I had no idea what was going on, and the doctor told me I had type 1 diabetes, and rapid weight loss is one of the symptoms. And fortunately, I was given a script for insulin and an appointment with the nurse the next day. I was completely overwhelmed. I had no idea what diabetes was. I have no diabetes in my family. I've been a runner my whole life. I had already done an Ironman triathlon and was in great shape. And I was really overwhelmed. So I went looking for help. The local hospitals in New York City had training classes, but they were months away. And I I just went on the internet, and so much of the information is very superficial. And I was fortunate to meet a great diabetes educator named Cecilia, a nurse, who fit me into her overbooked schedule and gave me the education, the personalized support, the compassion I needed to live an empowered life with diabetes, which thankfully I have. And then at the time I was working as one of the business development execs at Microsoft. And as I started to get back to the diabetes community, I realized, why are we not scaling Cecilia using tech? There's 32 million people in the US with diabetes. There's over 700 million in the world. And there's a limited supply of these great clinicians. Why are we not bringing them to more people? And that became the vision and really the inspiration for founding the company, which we initially called Fit for D. And then when I went back to find Cecilia a few years ago to thank her for her inspiration, found out she had passed away from cancer. And we decided to rename the company in her honor and memory, Cecelia Health.
Now that when I saw you unveil that at one of your events, and that was just so generous and so amazing, but just a true testament to how impactful she was on your life.
Absolutely. She's an incredible lady.
So when you were diagnosed, it seemed like you got your script, an appointment for the next day, but sort of thrown out to the wilderness, if you will. So when you think about Cecelia Health, let's talk about that first experience that you had in you're feeling overwhelmed, trying to find information. What pain points are you trying to solve for people who are diagnosed with diabetes?
Yeah, absolutely. And just for general education, of the 32 million people in the US, 95% are what's called type 2 diabetes, which is can be more controlled and is a progression of the state. Type 1 diabetes, which I was diagnosed with, the body does not create insulin anymore. So you basically have to take injections or use an insulin pump or you die. It's that simple. But the similarities of the complications create, if you don't take care of yourself for both states, high likelihood of cardiovascular disease or other complications. So they lump them together. The mental frame of mind is also very similar to your question. A sense of overwhelm, a sense of lack of knowledge, of education. There's a lot of diabetes technology out there, like continuous glucose monitors, blood glucose monitors. There's now a rich range of diabetes meds, from oral medication to insulin to other products. And also for people with type 2, a lot of times they may not need medication, or they might need it for a while if they adopt a different lifestyle, lose weight, improve their nutrition. And so there's a lot of behavioral work. But what we're finding is, especially over 50% of the people, and certainly the ones who are costing the system the most money, they're not downloading, an app, or they're not raising their hand. They're walking out of the doctor's office overwhelmed, like I was. They're asking family who, there may have been somebody who passed away in the family from diabetes, and so they're in fear, they're in shock, and they need a human touch. They need somebody to build trust with them and say, it's going to be okay. Let me teach you about this. Let me help you through it. You can get through it. You can live a rich life. And that really is a lot of the emotional journey that people go through. Sometimes it's not a straight line. It's ups and downs. And our goal is to help them be in the up place.
And you're right. There are a lot of apps out there. But you talk about that human touch. How do you scale the human touch, David?
The cool thing is we scale the human touch through technology. So if you just took a diabetes educator, and just for numbers sake, there's only about 30,000 of them in the US. So you have to be a nurse or a dietitian or a pharmacist. And it's very different to be a clinician without that credential versus with the credential. I always use an example of when I was being put out for a medical procedure. Before I went under, the nurse looked at my insulin pump here and asked me why I was still wearing a pager. That was a very scary moment for me right before, they put me out. But a nurse who's a diabetes educator would have said, oh, David, I noticed you're wearing an insulin pump. Let's talk about how to manage your blood sugars while we're doing this. And so you have a limited supply, and it's the same we'll talk about for endocrinologists in this country. And you have a growing number of people with diabetes. 1 in 3 Americans are projected to have diabetes by the year 2030, which is not too far away now. And we need tech to do it. So you can't just put a diabetes educator on the phone. That doesn't scale because everybody's going to spend different amounts of time on the phone, different issues. There needs to be a programmatic approach, what we call clinical pathways. So if someone's overwhelmed, what are the 3 best ways to get that person to take the first step? How do we create measurable goals? And how we've optimized it is, to be able to have more frequent touches that are shorter. We're not going to read you the book. We're going to get you to step 1, get you a lot of materials electronically, links to videos, and optimize the digital and human touch. We even go so far now as we work with health plans and we're able to get claims data, we're able to segment the patients into high, medium, and low. And the high really get the highest touch because based on the data, they're not taking their medication or their labs are showing that their diabetes is not great or whatever other costs are involved. And then medium, they're getting an integrated mix, and low touch is a more digital program. So it scales and it delivers ROI to the clients because whether it's a health plan or a pharmaceutical company, and we work with both, or an employer, at the end of the day, they want to take care of the patients, but at the end of the day, it also has to make money for them or save them money. So we have to be able to deliver this human touch in scale and deliver a return on investment. And then everybody wins. We deliver social impact and we deliver good business.
And diabetes, whether you're in a commercial population, Medicaid, Medicare, what have you, it's top 3 for every population, right? In terms of cost.
Absolutely. It's incredible. And in some ethnic, communities, it's even worse. I mean, here in New York City, 28% of the Latino community has diabetes, 1/3 of the African American community. And for perspective, the national diabetes rate is around 10%. So, an intervention is needed. We're in a crisis. We need to help these people.
All right. Wow, that's amazing. And we've heard a lot of talk over the past couple months about health disparities, and certainly those conditions are more prevalent in certain populations, and then comorbid conditions as well. When you have diabetes, you also may have another condition which further exacerbates the problem.
Absolutely.
So, how many lives can you share with us? How many lives has Cecelia touched?
We've helped hundreds of thousands of people over the years, and we've been doubling in growth for the last 3 years. We've publicly said that in 2019, we had close to 1 million live interactions. And when I mean live, that means that a diabetes expert clinician, or now we're also doing cardiovascular work and obesity, has engaged with a patient. It doesn't count the digital, the email, the text, the online support groups, and everything else that we're doing to engage the patient. So we've proven that we could take the human touch and scale it to large populations. And frankly, that's the way to create the biggest impact, is show we can go big. And so everything we do is about outcomes and then scaling the Cecilia, bringing it to everybody that needs it.
What a major impact that she's had on so many people through you, right?
Absolutely.
So when you think about yourself and when you think about Cecelia Health, what would you say is your differentiator when you think about some of the competition out there? And we've all heard of the Livongos and Amadas and so on and so forth.
So there's a lot of different companies trying to solve for the diabetes problem, and even Livongo, which just did its IPO and announced a merger, and its investor presentation shows a pie chart where they show less than 1% of the market. So there's no clear leader, really. There's a big problem that's unsolved for, and everybody needs to solve for a piece of it. Where we're really unique is that, unlike the Livongos and Omadas, we lead with the Cecilia first. And so when we analyze the data from a health plan or a self-insured employer, 80% of the cost comes from 20% of the population. And, in line with what I said earlier, these are patients typically not taking their medication, don't understand the why. So they're not going to download an app and begin, an electronic interaction. They need the human touch. There's one health plan we work with where we're also taking care of their employees. And there's 8 people who account for $500,000 a year of cost. So how do you engage those 8 people? 75% of the people with diabetes haven't had an A1C test in 2 years.
Wow.
Okay, this is a health plan, so it's not a matter of benefits. It's a lack of knowledge, of motivation. And if they don't know what their A1C is, chances are they're either uncontrolled in their diabetes, which leads to a higher mortality rate, higher complications, hospitalizations, cost, impact to their family, or they're either there now or they're getting to that place. So being able to target the most expensive patients, the ones in most need, and engage them. We're live across the US, 4 time zones in English, multiple dialects of Spanish, Chinese, and we're able to fit in around people's schedule in the evenings, on the weekends, when the kids are in bed at night, or on a Saturday when a spouse is at home. Because this level of personalization is how you remove the barriers to engaging with people. But it's an incredibly rewarding moment to hear, I'm calling on behalf of Health Plan X, and I'm your personal diabetes clinician for the next year. And that's a life-changing moment. I didn't have that when I was at Microsoft and there was a disease management company helping me. It was more a call center. But to be able to give that gift to somebody and really change the trajectory of their journey is great for people and is great for the health plans and the employers.
Yeah, most people wouldn't associate the term health plan with personalization, right?
Exactly.
So to be able to have somebody say, I'm going to be with you, I'm going to work with you, I'm going to stick with you, is really incredible, and certainly would bring great benefits back to the plan beyond managing costs.
Absolutely.
So let's talk a little bit more about how you engage, because one of the statements that I've heard you make is I've seen some of your presentations is that you can really help impact social determinants of health. Can you explain to our listeners how you're able to do that?
So one of the ways is it's really important that we understand not only the cultural elements, but where people live. Simple example, here in New York City, in certain neighborhoods, you wouldn't say, let's go get some exercise done and go walk in your neighborhood, right? You have to get them to a place where they could do it. Or if we're working with people in Nebraska, understanding that they're, farmers, and in certain times of the year, they're working from first light to sunset and fitting in around that. So, and do they have access to the food? Do they need to be guided to resources that are available to help them? They may want to make the right food choices, but they might not have access. They might be not able to afford it. So understanding that and guiding them to the resources, to how to make healthy choices, to the partnership. Typically, a health plan that we work with has a few different programs that we can guide them to. And there's a CDC metric around social determinants of health, which is called Healthy Days. And we've demonstrated that we've improved the number of healthy days that alone per month delivers a return on investment for the health plan, not only A1C and hospitalization, because that's an incredible measure. If somebody's in a positive state of mind, if they are taking care of themselves, it's a proactive intervention that gets them to a healthier place and aligns with SDOH.
Right, and I'm familiar with Healthy Days, and what I really like about that CDC measure is years and years and years ago, patients used to say, when you think of quality, it's different the way I think of quality. So when you use the term Healthy Days, that's putting it more on the members or the patient's terms. How do they feel? What is health to them? So if they feel healthy, as opposed to maybe what a clinician sees as healthy from a spectrum of, is this functioning or that functioning? I mean, this may be functioning, but I still don't feel healthy. So I love that I think that's a really great consumer-oriented term and really allows it to come in from that consumer perspective. So kudos to you for measuring it from the consumer's perspective.
Thank you.
So the other question I'd like to ask is, you've been in business about 10 years now. Is that right, David?
Yeah, we were ahead of the digital health. I mean, when we started, there was no digital health, there was no telehealth. So absolutely. Go. You were going to ask.
Yeah. So since you've been in business for 10 years, and that's good context setting, that's a long time. A lot of people wouldn't have persisted this long. So a question I'd like to ask you to share with our listeners is, what words of wisdom would you have for them, for somebody who's really passionate about something like you are, whether it's they're passionate about the work they're doing in a large corporation, whether they're an entrepreneur. What keeps you motivated? How do you stay engaged, and how would you advise them how they can keep themselves engaged in whatever they're passionate about?
It was probably first a mindset, and then I'll add a few other things. The mindset is, similar. I've said I'm a runner, I'm a triathlete. I always finish the race. I may be in the middle of the pack, or depending on the day, wherever I end up, but I finish. And you have to have that mindset as an entrepreneur, because there are challenges. It's rarely a week where, you could be cruising along and there's not something that's thrown in your way that's unexpected. In our case, I had the innocence of not knowing anything about the healthcare industry when I left Microsoft, and had no idea of the relatively slow pace that it moves compared to what I was used to in technology. And as I said, there was no digital health space. So it leads me into my second comment, which is focus on sales. So we innovated in our first 3 years because we had real paying clients, and we were not dependent on raising capital. In fact, we didn't raise capital till 4.5 years into the journey. And so we were able to figure things out, get proof points, show value, survive, test certain things, and then raise capital that we needed as the market started to heat up, and as we're seeing today. So some people might have waited till that time. I didn't believe in waiting. So you need persistency. You need to focus on sales all the time, because if you have cash coming in, you have choices, and you can decide what to do and how to leverage that growth, accelerate it, or keep it at whatever pace your goal is.
I just captured two really good quotes from you. The first is, I always finish the race. So I think that's great. I think that's a great mindset to have. And then when you have cash coming in, you have choices. And to me, that is really a testament to the, what do I want to say, how relevant what you're doing is, that you are able to generate sales. Most people, when they think from a startup perspective, is, I'm going to go out, I'm going to talk to investors, I'm going to raise $1 gazillion and then figure out, but the fact that you were able to go for 4.5 years and you were able to bring money in, and then you went to investment to be able to expand and do other things, is really a testament that this is relevant. People need this product and service, and health plans need it. So good for you.
Thank you.
So that you mentioned this, healthcare system's very complex coming from the technology standpoint, and it can be overwhelming. Oftentimes what I hear from professionals who are listening out there is, look, I work in a large corporation, and if I get out of my swim lane to try to fix something, the customer experience, make the product better or the service better, there are all these barriers. You really get knocked down. So again, just maybe a little bit more of what you were just sharing about is, what advice would you give to them, especially somebody who's in a big corporation dealing with that complexity, and they said, I know I can make this experience better, but boy, they keep hitting obstacles. What would you recommend to them?
If they're inside the corporation, whether it's anywhere in the healthcare landscape, it would be great to get executive support for the vision that they have, and commitment to the duration of that commitment. Often we see there's innovation groups, and they may have limited budget, they have limited authority to actually move it into a scalable, repeatable program within the organization. And they may have a career arc that they're doing this for a year or two, and they're moving into some other role. So the health plan or any other entity in healthcare really needs to say, okay, this is part of my DNA. I recognize the problem, whether it's diabetes or something else. Diabetes is actually ranked as the #2 problem by many of the chief medical officers in this country. And as COVID recedes in whatever way it does, it's going to be even worse because people have been inside, not exercising, and the sense of isolation and impact is going to be larger. But again, getting commitment so that they can champion a program and it's safe for their careers. That's not going to be. It's okay to fail. Like you could test 5 things, and if they all fail, well, then you save the company of making commitment to any of those 5. Ideally, you can get 1 or 2 that'll succeed. It'd be nice if the corporation would reward that success, almost like in an entrepreneurial investor mode. How about a bonus for bringing on something that brings the company a benefit to its profit P&L, income statement? Bring an idea that's scaled out. So within the organizations, I encourage the leaders to think of how to foster innovation and give safety to the employees who are willing to make the commitment. And then to the other side, how to work with innovators like us that is also safe for us, because every day it's a choice of time. Where are we going to spend our time that's going to create the most value for our patients, for our clients? And those are hard choices. And usually with large plans, things can, delay. We have one health plan client where we won a RFP almost a year and a half ago that we're just finishing the contract now. So we've invested probably $100,000 in this client, and we've yet to see any return. Now we're fortunate we have enough diversity we could handle that now, but in earlier days we cannot. So being sensitive to that, and how do you help the innovation? Can you fast track certain things? Can you help in other ways so that you have a win-win partnership? Because everybody's trying to get to the same goal. So how can you do that you're not crushing innovation, but you're accelerating it? That's the secret sauce.
I really appreciate your comments on the impact that working with a large corporation can have on business partners such as yourself, because I think oftentimes we don't realize the challenges that we as a large corporation put on business partners. So that is a really key takeaway that I would have for all of our listeners out there. If you have the opportunity to be in charge of or really participate in an initiative, how do you fast track it, and how do you help the external business partner be successful? And you're absolutely right, David, to pull somebody off to do a file feed for a partner that you may not see revenue from in a year and a half, right? Versus putting that person on enhancing your product so you can actually go get the next deal done. Oftentimes large corporations just don't really understand the impact that they have, the negative impact they can have on smaller business partners. So thank you for raising it. And I think that's a really important takeaway that all of our listeners can learn from. And then the other piece that you said is, when you talk about innovating, I'm gonna maybe put words in your mouth a little bit, but you can innovate inside the business. We have a lot of business people here that aren't sitting in an innovation center. And I think the innovation centers are great. They want to partner with the business. But there are lots of things that you can do as a line leader or whatever that can get something done in a small scale to start within your own area. So don't assume everything has to go big and broad initially. Try a pilot, try it within your area, get your immediate supervisor and her supervisor to approve it for a small test, and let's get going. That's just plant the seed. Sometimes we think it has to be a big grand thing, roll out nationally, when really what you just need is a pilot. You need to just get something going.
Absolutely.
So David, our listeners really love to learn and would like to understand, what books are you reading, or what books may have inspired you, and what podcasts are you listening to?
It's a great question. So actually one of my favorite books is Rules for Renegades, which is a book about an entrepreneur that was originally started at Microsoft and ended up becoming a yoga guru. But her journey talks to entrepreneurism. It talks to how to deal with rejection, which again, if you're pitching a bold idea, you're going to get 99%, if not more, rejection, and you have to be able to cope with it and go forward. especially if it's something new that's never been done before or disruptive. And then frankly, besides that, I have to admit that when I turn off, I go into meditation. I found is my reading now and my time breathing, because I give it 100%, if not more, every day. And when I stop, it's better for me to actually breathe and just be present. And so that's what I'm doing outside of my work right now, and besides triathlon and my family.
That's great. Yeah, and it's great that you were able to return back to your normal activities, or your athletic activities. That's fantastic.
Thank you.
Any final words of wisdom for our audiences you'd like to share, David?
I think for the entrepreneurs on this, for the would-be entrepreneurs, for those of you in industry, it's an incredible time now. We got a boost from COVID, not for a good reason, but a boost that healthcare is critical and telemedicine is critical, and there's people in need across the country, and we could be a model for the world right now. And if any of this inspired you in any way, do whatever it is you're dreaming of.
Well, can't say it any better than that. So David, thank you so much for being with us today. We really, really appreciate it.
Thank you. My pleasure.
And for our listeners, that's another wrap of Be Time. Talk to you soon.